So welcome everyone for attending our information session for our graduate programs in population health management. My name is Morgan Fredericks, and I am the admissions officer here for all of our MAS programs, all of our OPAL programs, so our population health management program, as well as a certificate as well. So I will kick it off to Dr. David Baker to start our introductions.
Hi, everyone, and welcome. Thanks so much for joining us today. My name is, David Baker. I am co-director of the program along with Mark Biddle, who may or may not be joining us today. I think he had a conflicting meeting at the school. So I also teach in the program. I'm currently teaching a course and have been teaching with the program for over 5 years now. It's been really a great experience just on my part to see all these mid-career professionals come together, learn about the program, and share kind of their knowledge with one another. It's even though it is a 100% online program, we do have group projects and other ways for people to get together to work jointly on projects and really learn from one another. So I think if you apply to the program, join the program, you'll see that and really get a lot out of it. But Morgan, I'll leave it at that if you want to continue.
Yeah, absolutely. So we have one of our current students with us today, Becky Vest. Would you like to introduce yourself as well?
Sure. Hi, everybody. I'm Becky Vest. I'm a nurse and I work in chronic disease management for a Medicaid HMO payer. And I am in my second year of the program, and it's been really great. I've learned so much that I've been able to basically immediately bring back to my team. So it's been a really rewarding experience.
Thanks, Becky. Okay, so I'll kind of go over the agenda for today. So we'll start chatting a little bit about an industry overview. We'll go over the program details and curriculum, share a little bit about how online learning works here at Hopkins, highlight some of our esteemed faculty and alumni. I'll go over the admissions requirements and financial aid for the program, and then we'll have a Q&A session. We'll start the Q&A session with chatting with Becky a little bit and getting a little bit of her perspective in the program. And then anyone on the call can feel free to ask any questions to any of our panelists today. Okay. Dave, would you like to cover some of the program content with driving forces in pop health?
Let me just unmute myself, but sure, yeah. I just wanted to kind of highlight some of the reasons why we put this program together. So really the driving forces behind the program and the purpose of kind of the content that we're sharing. So driving forces include population health managers who can draw upon public health tools and be leaders of tomorrow's healthcare system. So this was shared by Dr. Joshua Sharfstein. He's former secretary of the Maryland Department of Health and Mental Hygiene, also associate dean of public health practice and training at Hopkins Bloomberg School of Public Health. So we know a couple of things have been happening over the past several years. So the U.S. health system itself has evolved to be a very fragmented and based fundamentally on the acute care model. So teaching or basically treating people who have acute issues and present to hospitals. Demands for accountability in the management of healthcare resources and the financial, political, and social winds of change in terms of outcomes. So we need sort of a different model to get us to a lower cost, better outcome system. And this shift from volume-based to increasingly a value-based reimbursement models that create incentives around integration, care coordination, and collaboration, and thinking it really outside the four walls of the traditional hospital and health system. So improving health really requires a focus on the determinants of health, so those upstream issues beyond that chronic episode of care or acute episode of care. And population health management really brings focus to the health of populations by promoting the integration of public health practice, a lot of tools into the management and delivery of healthcare services. And so a little bit about population health management at Johns Hopkins. So population health management has emerged as an important strategy for healthcare providers and payers. The Johns Hopkins School of Public Health, the Bloomberg program, is the #1 program in the country and was among the first 2 programs in the country to focus exclusively on population health management in 2017. In 2022, the Population Health Management Program was among the first 5 to receive accreditation from the Commission on Accreditation of Healthcare Management Education. It's an interdisciplinary program that provides experienced professionals such as yourself with a comprehensive approach to developing population health management systems and strategies, and really leading transformation to a value-based, population-focused models of value-driven, accountable care. And this interdisciplinary curriculum also examines the importance of the determinants of health, which can include medical care, public health, genetics, personal behaviors, and lifestyle, and a broad range of social, environmental, and economic factors. Next slide. And this at a high level is the curriculum for, it's a 2-year program for the master's degree. There are 25 credits in year 1, and some of the courses, and you can see some of the courses here that you'll be taking. Traditionally, folks take 2 courses per term. So there are 4 terms a year, and this is what you will take.
Yep. And then I will just interject here. We also have a certificate program in population health management, and the certificate program is essentially half of the MAS program. So some students just opt to do the certificate program. It's the first year, essentially, of the MAS program. Some students decide they want to start with the certificate program and then transition over to the MAS program. So after they complete their certificate, they just reapply and apply for the MAS program, and all of those courses that they've taken in the certificate program obviously transfer over into the MAS program. We always suggest students who are thinking about starting with the MAS program to just shoot for that, because then that saves you time in doing 2 applications versus 1. And then once you're matriculating through the MAS program, as long as you're in good academic standing and checking off all of your boxes, you can be awarded the certificate as well.
So some additional program details. So Morgan just reviewed the graduate certificate in population health management, which is again about sort of half of the overall master's degree program, and the Masters of Applied Science in population health management. And this includes, in addition to the courses, professional development and a sort of a capstone project at the end, an integrative activity where you really bring it all together, sort of all that you've learned over the 2 years. And this is really a skills-based program. So it's designed for people who really want to apply what they're learning in real time, and come away with very practical applied tools that they can immediately apply to their work. It's a part-time program, 100% online. We have group learning. We allow peer assessments. So if you are working in groups, and when you're working in groups, you have the opportunity to kind of review your peers and you. Just to give you examples of some of the coursework and projects, and I'll speak from my class, which is just started last week. We have a sort of a class project, which is divided up really into 3 assignments that build on each other throughout the course. And I have a lot of examples in my lectures from my work. I should also add, in addition to being on faculty for the program, I also work full time. So I'm executive director of population health at LifeBridge Health here in Maryland. It's a 5-hospital health system that sees a variety of different types of populations. And really the overall focus is on leading population health management to improve health within and across different populations. So some of the careers in population health. So this program is targeted toward both clinicians and managers who are actively engaged in working in hospitals and health systems. We've had people in insurance companies as well, working on value-based, population-focused care delivery. We've seen a high demand for healthcare administration and management jobs, with about a 17% growth. The concepts of population health management appeal to and could benefit a wide range of healthcare professionals, and is really an essential base of knowledge for healthcare executives today. Some examples of titles that benefit from this program: Vice President of Population Health, Director of Healthcare Integration, Director of Community Health Operations, Population Health Initiatives Managers, and that kind of goes on and on. Next slide. And I don't know, Morgan, do you want to take this, or do you want me to kind of cover this?
Yeah, I can touch base on it. So it really kind of just covers online learning here at Hopkins. So we have over 20 years experience in the online learning sector. The courses here at Hopkins have a very high production value. All of your seminars will actually be pre-recorded. They go to a team that does editing, and you can actually view them at any time at your leisure. So you can download them and watch them, no specific time where you have to watch your courses and have to watch your lectures. The hybrid model allows for peer collaboration and student-faculty engagement through Zoom-supported synchronous sessions. So I always like to say that the program is really an asynchronous program with synchronous options to the program. And what I mean by that is we have sessions called live talks throughout the courses, and live talks are an opportunity for students, faculty, sometimes guest speakers to come together at one specific time to chat about something. So it could be a particular topic, something going on in the classroom, a project, something of that nature. But it's one of the one times that everyone's kind of together in a Zoom-like classroom experience. Again, the program is an asynchronous program, and we have students all over the world. So we understand that you can't always be there for live talks and things of that nature. So they're even recorded. So you don't have to worry about missing those. And then we have a 24/7 help desk accessible to all students. So we know students, again, are working at all hours of night. We have a lot of students who are busy, so odd hours are great for them to get their work done. So we're here to support you even in those odd hours, kind of getting through if you have any issues. Okay. And I can chat a little bit more about the admissions requirements. So to get started with us, we would need you to complete an application in SOFAS. And then we also use SOFAS Express for our certificate program. And then the regular SOFAS again for our MAS program. All students are required to have a bachelor's degree from an accredited college or university. All students are required to have a minimum of 3 years experience in a health-related field. We would need a copy of your resume or CV that kind of highlights that experience. Now, for recommendation letters, if you are applying for the certificate program, we actually only need one recommendation letter. If you're applying for the MAS program, we would need 3 recommendation letters. For your letters of recommendation, we strongly suggest at least one of them comes from maybe a previous academic advisor or current supervisor, or previous work supervisor. We totally understand that everyone may not have graduated from undergrad a couple of years ago, so may not have still the same connections in undergrad, but we definitely will look at kind of current supervisors as well. What I would say is the most important part of the application is your statement of purpose. Your statement of purpose really is how you present yourself to the admissions committee for the first time. A couple of things that I would say are important to go in your statement of purpose is really your understanding of what population health management is, how that relates to maybe what you're doing now and what you see yourself doing in the future. So again, I can't stress it enough. It is the most important part of your application. Our admissions committee really takes time and reviews the statement of purpose just to make sure you're a great fit for the program. For our international students, they do have a couple of additional things we need. So some international students may need to complete an English proficiency exam. Sometimes they can be waived if you've completed a bachelor's degree in the United States or something of that nature. I'm always open to talking one-on-one a little bit more about that. And then some students may need to have their courses evaluated if you've taken courses outside of the US. For people who have taken courses inside of the US, we would need copies of all of your transcripts. So even that one little, transfer of credit that you took in community college, we need an official copy of that transcript as well. Would you like to chat a little bit, Dr. Baker, about some of our faculty?
Absolutely. Yeah, so this just shows you the faculty for the program now. The majority of these folks, I would say, are either sort of full-time faculty in the School of Public Health or, actual practitioners like myself. And they bring a wealth of experience. You can see at sort of the bottom box the department affiliation. So they really are from across the School of Public Health, and they bring experience and really expertise in a variety of topics. So you'll get really a thorough and comprehensive education through this program. Yep, and I guess we can go to the next slide.
Okay, so back to admissions. So our application deadline is actually July 1st. We suggest students to apply much sooner rather than later. The applications will be reviewed on a rolling basis by the time applications are submitted and verified. Ideally, we try to get a decision back to students in about 2 weeks. One reason we suggest students apply sooner rather than later is a lot of times you would assume that getting a lot of your application materials in would be rather quick, but sometimes it takes a little bit longer, especially when you're looking for transcripts. You're trying to get letters of recommendation. All of those things sometimes can be a little bit more time consuming than one would assume. And then all students would be starting in the fall. I think our fall start date this year would be August 26th. So a little bit about the tuition and financial aid aspect of the program. So the current tuition is about $1,321 per credit. Now, one great thing about applying to OPAL is that you would be awarded an OPAL scholarship. And the scholarship is currently $580 per credit. The scholarship application, it's no separate application. It kind of goes along with your admissions application. One other great thing about the scholarship is it actually covers 38% of the tuition. So it's a pretty hefty savings that students don't even have to apply for. And then we also have different financial aid options here at Johns Hopkins as well. We have a great financial aid office that can assist students in applying for federal as well as private loans. For students that are interested, I can also send you additional funding resources as well. We've had a list of scholarships that students have previously been successful in obtaining, so I can send you that list to see if that's something you may be looking to apply for as well. Okay, so that wraps the formal part of our presentation today. We will now kind of start the Q&A session by asking Becky a couple of questions about her experience, and then we'll open it up to everyone else on the call.
That's great. Thanks, Morgan. And I think what we'll do is I'll just, so we're very pleased to have Becky Vest with us today. Becky is in her second year of the program, so can speak to kind of a lot of the classes that we've been talking through. But I wanted to ask her kind of a few questions just to kind of get us started. And then as Morgan says, we can go into a kind of a Q&A session where you can ask specifics about the application process or about student life, what it's like to be working and studying in this program simultaneously. So Becky, I know you've already introduced yourself, but maybe say a little bit about kind of where you live, your current job title, for folks who joined maybe just recently.
Hi, yes. So I'm Becky Vest. I'm a nurse, a registered nurse in Milwaukee, Wisconsin, and I am working on a population health management team that I've been helping my leadership kind of lead and initiate. It's a newer department within our healthcare services or care management program. So it is for a Medicaid HMO. And we've been really trying to switch focus from chasing after high utilizers in the hospital to more of a chronic disease management and care coordination effort among our patients or our members who have diabetes, hypertension, asthma, and also following up after like behavioral health hospitalizations. And so we've formed a team of about 8 of us, following different measures, really closely aligned with our HEDIS goals, and really trying to close gaps in our HEDIS measures. So that's kind of what brought me to this.
Yeah, that's great. And can you talk a little bit about what brought you at this point in your career to look at graduate programs and specifically population health management programs?
Yes, absolutely. So I have my BSN, my undergrad from University of Wisconsin, and I just learned that I love nursing and I love it as a profession, but I feel a little bit constrained by nursing to work on larger problems that I've witnessed in my over 15 years of nursing in Milwaukee. So I started out at bedside and med-surg, then into community case management for Medicaid waiver programs. And now I'm working with Medicaid patients or members, mostly in Milwaukee, and really kind of fighting against the downstream results of lack of help in areas outside of the 4 walls, so of the hospital or the clinic. So we think of the traditional, the 4 walls, and how healthcare is so siloed. And I've really I've been working one person at a time, trying to work on these issues, whether it's trying to help them gain access to entitlement programs that exist in our county or through the state. And I just have decided that I'm at a point where I would like to be able to work on problems upstream and impact my community in a larger way than just one. I mean, one person at a time. Each person is really important, but it's really tough to keep kind of fighting that battle day by day to try to help people access services. And I just think that we could make things a lot easier. So this program has really helped me be able to look at things in more of a systems view, rather than on these one-off, individual one-on-one interactions that I'm able to have as a nurse.
And what attracted you to the program at Johns Hopkins versus other programs?
Sure. Well, we do have a really robust population health program at University of Wisconsin. I did inquire both at UW, where I am, and at Johns Hopkins, and I actually received a phone call from a human being at Hopkins, and so I did get a nice email from UW, but I did get a call from someone at Hopkins, and I guess I'd always held Johns Hopkins in such high regard and high esteem. I never thought that it would be something that would be accessible for me. I just never considered it. And then it kind of became a reality. And then really when I was looking at the two programs and looking at the cost, with the OPAL scholarship that Morgan was talking about, it's actually more affordable for me to attend Johns Hopkins for this master's than it would be for me to go to my state college. So, kind of romantically, it was, oh, wow, it's Johns Hopkins, but pragmatically, it was actually more affordable for me to attend Johns Hopkins. And of course, the program is really, really amazing. One of, one of the first ones in 2017. So I feel like it has a really good history behind it.
And having gone through, over half the program at this point, what would you tell people who are considering applying based on your experience?
Well, really work closely with the admissions officer. So work closely with Morgan. I didn't have the pleasure of working with Morgan at the time that I applied. But the admissions officer that helped me was just wonderful. And they really helped walk you through every step of the way. I know Morgan did mention apply it's sooner rather than later. One of the wonderful things about this program, especially for me, because I was returning to school, it had been some time and I was concerned about, if I was going to remember proper in-text citation, right? All of these kinds of things you think about as you're returning to school. And then I was also thinking about well, it's very far from me. I'm in Wisconsin. And there's a lot of really great onboarding material, like a lot before classes begin in August. So it's good to be able to have that time over the summer to really pace yourself through the onboarding process. I can say that I learned a lot about the culture and the history of the school, and also just really practical things about how things work at the school and how to access the library and things like that.
And what skills or tools do you feel that you've gained through the actual MAS program itself?
Oh, wow. So much. I feel like it's been a long time since I started, but I would say that it's helped me to have a language to put around the problems that many of us are facing in healthcare. So it's a newer field, especially here in the Midwest. Population health management and value-based care and value-based agreements and pay for performance. And it's just really helped put a language to it. I've been able to use some of the first term, kind of more introductory information to help educate the rest of my team so that everybody understands why it's so important that we're working on closing these HEDIS gaps and things like that. Technically, I would say that the population and consumer health informatics course really helped. There were some very practical projects or assignments that we had that I was able to really kind of pull over into my work in terms of, like, an example is using medication possession ratio. I work for a payer, so we don't have EMR data. So trying to figure out who might some of our members with diabetes who are having a hard time controlling their A1C, who might they be if we don't have that A1C? So looking at members who had medication possession ratios of less than 80%. kind of helped us hone in on stratifying a group of members to reach out to, because, when you have a group of 1,600 members on a list, then there's 4 of us to call. We have to have a way to meaningfully stratify those members. So that's something that I've learned a lot from the program, is how to think about populations and how to use our resources more wisely.
Excellent. Thank you. Anything else at this point before we open it up to questions and answers that you'd want to share with folks?
If you're thinking that this is speaking to you, I would highly recommend applying and looking into it. I know when I watched the virtual open house and I showed it to my husband, he was like, Becky, this is what you've been talking about. This is what you've been frustrated by, is what they're talking about. You need to do this, so I didn't know that I would be able to do it. I didn't know that I'd be able to be accepted. And I had some self-doubt around it, but I've been so pleasantly surprised by how warm and welcoming and friendly and just very, very kind everybody in the Hopkins arena has been. So I think it's an amazing experience. If you have any interest in it, I highly recommend applying.
Great, thank you. Well, why don't we open it up then just to questions that you might have? And these could include, questions about how do I apply, requirements for applications, or, what student life is like, questions about courses, etc. Happy to answer anything. Yep, and go ahead.
Hi, I have a question. My name's Fayette Wernick. I'm a physician assistant, and my experience has been purely clinical up until this point. But Becky, I feel similar to you. I'd like to try to find a way to transition into this other side of healthcare. We're helping to solve the problems. One of my kind of concerns, or academically, that makes me a little bit nervous, and maybe there's some kind of summer prep work, is the statistics aspect of the program. I mean, I haven't taken a statistics class since undergrad, and I think I took one. So I wanted to ask a bit about that. I know that when I was looking into the program before, it looked like there were some options of some statistics courses that you could take as like almost a refresher to kind of get an intro and a reestablishment of it before starting the program. So I wanted a little bit more information about that.
Yeah, no, I'd first say you're not alone. Most people who come into the program, it's been a while since they've taken a lot of these academic courses. But we do look in the applications to see evidence of quantitative ability. So it may not be statistics, but we do want to see that, maybe in your transcripts, for example, the admissions committee will look for evidence of, strong performance in quantitative courses. But we've also had applicants too who have done refresher courses, to again sort of demonstrate that that this is something that they can do. They'll be able to handle the biostats course when it comes up. I don't know if Becky, did you want to speak to that at all from your experience?
Yeah, I'd love to, actually, because that's an area of weakness for me. And so I was concerned about not having enough quantitative experience coming into the program. I did very well in stats. I surprised myself, but I think a lot of it I owe to the faculty and the TAs. And so something not just for stats, but for all of the classes, a lot of the classes that have a little more rigor, like stats, epidemiology was another, they have TA office hours quite frequently throughout the week, and they'll do it at different times of the day and in the morning and on the weekend. And so when I did struggle with a concept, I was able to bring it to TA office hours and really come out of it feeling like I had really mastered it. So I went into it very weak. I had the same concerns about it, and I came out of it learning a lot and actually doing really well in stats, which surprised me. So, but the support from the faculty and the TAs was amazing. I think there were TA office hours nearly every day of the week for stats, or maybe 6 days a week. So it was possible to find time that fit into my schedule to be able to meet with them. So there's a lot of support for that.
Okay, great.
Other questions?
Hi there, this is Jackie Wood. I'm a senior population analyst. One question I would be just with balancing working full-time and then obviously doing this program, when do and I apologize if this is already talked about, but when do classes typically are held? I'm based in the Salt Lake City area, so there would be a time change difference there, but just kind of getting a better understanding of kind of class scheduling and how I'd be able to, if accepted, be able to modify that.
Yeah, sure. That's a great question, and nice to meet you, Jackie. One of the things that this program has done is really made the coursework really almost 100% asynchronous. So each 8-week term, each 8-week course will be you'll decide sort of when you want to view the lectures, when you do the readings. When there is, a lot of the courses do have group work, and the faculty will try to arrange groups, and I'm speaking for myself, arrange groups living in the same time zones when possible. So, people on the West Coast will try to, group them together, so they're not working with, trying to kind of figure out when people are available. But yeah, it's really designed for people working across the United States. I think, as Morgan said initially, we do have folks from Europe, from other countries across the world. So it's definitely doable. And really, it's designed for that, for people like yourself working in trying to balance work and school.
Oh, thank you so much.
Sure.
Yeah, and then I will also note, we chatted about the majority of, well, not the majority, honestly. We chatted about some students taking 2 courses at a time, and that will have you finish up the master's degree in 2 years and the certificate in 1 year. But a lot of our students stretch the program out to better accommodate their schedule. So you definitely also have the option to kind of take 1 course at a time as you matriculate through the program. Yes, it will take a little bit longer, but it sometimes just works better with some of our students' schedule.
Awesome. So there's flexibility. For example, if, let's say, for 1 8-week period, I took 2 classes and then I dropped down to 1, depending on like being busy and like during the time of year or whatnot, and then being able to bump back up to 2, that's something that could be accommodated.
Yeah, I would definitely
Okay.
say it can become accommodated. Once you are admitted in the student, as a student, we have someone named Aiden. They are excellent in kind of tailoring students' kind of schedule and course plans to what works best for them. I will say some of the courses are only offered once a year, so I would keep that in mind. But you do have flexibility to take 2 courses one term, 1 course another term.
Thank you. I appreciate that.
Mm-hmm. Any other questions? And feel free to come off of mute. Feel free to type your question in the chat box as well.
Actually, I have one question. I worked in healthcare for more than 20 years. I was the vice president of a healthcare medical facility located in Long Island. But I actually began going back to school roughly 4 years ago at Georgetown. So My expected graduation will be May 17th next year. And I noticed that your application deadline is by July 1st. Would I still be able to apply early, like right now? Or should I wait until I get my diploma and then submit it by May 17th? That's my question.
Great question. So yeah, you still can apply now, but May 17th, we would need your transcript like as soon as possible with your degree conferred. So we do have students again that apply, before finishing a degree, but as soon as the degree is completed, we need that transcript. Although July 1st is the deadline for submitting your application, there is a little bit of wiggle room by a couple of weeks to get all official documents in as well. So you do have just a smidgen of wiggle room after July 1st. But yeah, you can get started on submitting your application prior to that.
So the decision will still be processed, but it's just that I will have to provide all the supplemental documents that are required just to.
Yeah, so if you haven't graduated, we would need a copy of your transcript now, basically showing that you have completed quantitative coursework, so we can see that you do meet the admissions requirements for the program. And then I think it technically would be a conditional admission, depending on what degree you're completing. And then once the degree is completed, we would need the official transcript with the degree conferred.
Thank you.
Yeah.
I have another question. As I mentioned, I'm a physician assistant and my roles have been purely clinical up until this point. And I'm definitely interested in this area of study. And I feel like I would love the program. I guess my biggest concern is once I've completed, what would be some career or job opportunities for me in my situation without actually any prior career experience in the field? And do you guys have examples of other students similar to me who were either nurses, nurse practitioners, or PAs that have purely only clinical experience, completed your program, and then able to like transition into the population health field?
And so I'll just start off, and I think that's great. And we like having clinical folks in the program. It really benefits all of the other students to get that perspective. And I'd say we've had a lot of physicians, nurses, PAs, nurse practitioners, and who have gone through the program and gone on to either get promotions to maybe more administrative or operational kind of focused positions, or expanded positions. So clinical plus additional, maybe management, leadership type opportunities. I don't know, Morgan, if you're familiar with specific examples, but it's definitely not uncommon for that. We do see a lot of folks come in who've seen that sort of clinical side of things, get frustrated with kind of the way things currently operate, and want to kind of broaden their expertise and their really toolkit and skill set to be able to make a difference. And doing that usually helps them get a advancement in their current with their current employer or with another employer going forward.
Yeah, I don't have any specific examples off of the top of my head, but we do have, like Dr. Baker said, a lot of clinicians in the program that add value to the program and do transition well after the program. I can definitely follow back up with you with some different opportunities that some of our students have actually pursued that were coming from the clinical background, just so you can see more specific examples as well.
Yeah, that would be great. I mean, I've even kind of gone on Indeed and I'm just trying to wrap my head around what are the jobs out there that are available with this degree, and then what are the backgrounds of those folks who are in these positions? Have you seen clinicians start out as purely clinical, complete the program, and then say go into healthcare consulting, or healthcare consulting, and then being a clinician? I would prefer to kind of be on the clinical operations side of things. That's kind of one of my concerns is, gosh, if I spend all this time and money on the program, what's on the other side for me,
Yep. And just to add, I mean, speaking from my sort of professional side of things, certainly seeing an applicant who has, I think it's a nice marriage, really. Someone who has clinical background and also specific population health management background, which, provides that sort of additional layer of ability to work and see sort of big picture views of like how do you manage different populations of people and bring them toward health, and really kind of understand what are the root causes leading to their kind of acute health episodes. I think that brings sort of a more comprehensive kind of whole candidate to a role. And that would certainly kind of rise to the top of my list of applicants for a position, managing populations. I think we kind of at a high level noted some of the positions available. Certainly directors of population health, directors of care management, directors of health equity, vice presidents of population health, kind of all of this together, I think, combined with somebody with a knowledge of how healthcare works, is kind of a nice package.
Thank you.
Other questions, comments?
Will you all be sending this information out? This like PowerPoint?
So I can send you the PowerPoint, but
Okay.
we will be, we recorded the session, so we'll be emailing
Perfect. That
everyone the
works.
recording as well.
Great, thank you.
Mhm.
Anything else? Well, we still have you. And I'd open it up to Becky too, in case you have other things you'd want to share, or this prompts anything in your mind as a current student.
Sure. I was thinking about Julie's question about really, to me, I was hearing work-life balance, work-life school balance. So, I do work full time. I have a young child at home. I have a very active, busy family life with most of my family living here within like 5 to 10 miles of me. So there's always something happening. And I can say that I'm able to really give a lot of energy and thought to this program, and I'm doing really well in it. But I also have strangely enough time to still be present to work and present to my family. Now, something I have done is I have planned to take the first day of every term off. Once I figured that out, it was really nice to have that first day where I just like took a day of vacation and I just sat and went through everything that was coming up and kind of mapped out my plan and kind of looked at my calendar to see what do I have going on with my family, what do I have that's important for work. And so, but I do feel that it's been very, very manageable. I did, as a nurse, I entered with my ADN years ago, and I worked full time and had a child and got my bachelor's. And so I would say that this time around, it's much more manageable, and so I do feel that the program's really well designed for the working professional. So that's something to keep in mind too, that it's very I think it's very doable.
Thank you.
Yeah. Oh, I'm sorry, Jackie, I misspoke.
No worries.
Essentially it's Jackie.
No worries.
And then the most recent question about roles. So I have been really drawn, now that I'm in, my second year of the program, I've really been drawn to health equity positions. And I've been seeing a lot of health equity strategy, health equity director from like our state Department of Health Services to there's a national director of health equity position open in my current organization. And so there are a lot of, I think, emerging roles in the space of population health, health equity. I am in a care management department now, but working in quality, we've had a couple of new positions sort of open up within my organization. So, kind of keeping an eye out for some of these newer positions that are coming up. There's a manager of provider quality practice transformation, which might be a really good blend for someone who's very clinical and also gets through this program. So there are a lot of, searching under like population health, I don't always really find a lot of things, but when I'm looking through some of the larger health systems or at the state level under terms like equity, health equity, and population health or population or quality positions, you'll start to see things that are really trying to address the bigger upstream problems that contribute to poor health outcomes down the road. So those are some of the ways that I've been looking into finding different roles too. I don't know if that's helpful or not.
Yeah, that's really helpful. One thing more to add is community health is another category that you'll often see job postings for. Excellent. Well, I think we're getting close to time. Any final questions before we kind of close it out? And if you haven't already, please, scan one of these QR codes. And Morgan will be sending this out too. But if you have any questions, you can feel free to contact Morgan by email or phone. All right.
Yep. So thank you everyone for joining us today. Really appreciate it. As Dr. Baker said, I will be sending the recording of this out to all of you. Hopefully we will see your application in soon. So have a great day, everyone.